Healthcare data management. So today I'd like to talk about some problems we face with current electronic health record keeping systems, and then a solution we can use to fix these problems. So first I'll talk about the problems with our current technology and methodologies used to hold medical data. So according to Drew Ivan in his research titled Moving Toward a Blockchain-Based Method for the Secure Storage of Patient Records, as recently as 2008, less than 10% of all medical records were stored digitally, but today nearly all of them are stored online. The problem is this data remains largely non-portable. Ivan goes on to state a main reason for this. Healthcare providers perceive their patients' medical records as their own property rather than their patient's property. This makes it harder for the patient to leave or seek care from another institution because this institution is holding their medical data hostage. So, don't you think this is counterintuitive to the goal of providing healthcare service to a patient? A patient should be able to access their medical records freely. Legally, they are owned by the medical institution, but where should the line be drawn? Another issue with medical record keeping is the security. According to Ivan, a majority of patients are concerned about the privacy and security of their medical records, sometimes leading to a withholding of certain information to a provider because of these concerns. And the concerns are valid because data from a government report shared by Ivan shows that 100 million plus people were affected by health information breaches in 2015. So a question arises. How can we prevent security breaches while allowing the patient to permit certain medical institutions access to their data? So I present the solution, blockchain technology. There are three key parts of blockchain that solve current health record keeping issues. One, decentralization. This would put medical records in the hands of people and decentralized from the institution. Transparency, which provides patients and the providers access to the data whenever it's needed. So patients would actually have access to go check their records whenever they needed without having to go through their provider. And then also security. So it's impossible to manipulate this data and it can only be accessed by the provider and patient, the appropriate parties. So using blockchain for health records. Ivan says that in a secure blockchain system for health record keeping, the information would be encrypted, stored in the blockchain, and only could be decrypted by parties that have a patient's private key. This would keep the transaction data all in a chain, which so a patient could access their data and see the progress of their medical history, and it would all be encrypted and available to the patient and the provider. So Marco Iansiti and Kareem Lakhani in their Harvard Business Review article titled The Truth About Blockchain talk about TCP/IP as a kind of analogy towards blockchain technology. Originally, TCP/IP was used just for email, and it was the basis for sending emails. And we know that blockchain is used for mostly just Bitcoin right now. It's moving into other things, but it was really only used in Bitcoin at first and enabled these bilateral financial transactions. But we can apply a blockchain strategy to healthcare data management and other systems. So, although blockchain only has that one prominent use case in Bitcoin now, we can easily see the importance of trying it out in other industries like healthcare. And this will take a lot of research and experimentation. Ivan also stated in his aforementioned work that to achieve high rates of electronic health record adoption, the Centers for Medicare and Medicaid Services has spent over $30 billion since 2011. So it becomes clear that a new approach to this record keeping, like blockchain, will have to supplement current technology and work alongside it to store a patient's data as blockchain becomes widely adopted. There is still research to be done and trials to be conducted. In conclusion, a blockchain system is a system that can be used to keep records of your medical data. It will maintain decentralization, transparency, and security of your health records by allowing you and your providers secure and reliable access to it at all times, while other systems only allow your healthcare provider access to recorded data. The data is impossible to be manipulated, and you can remain confident that it will only be accessed by the parties you authorize, while with today's technology, none of that is fully assured. Thank you.